we talked about all of the shareholders in treating myeloma patients. We haven't talked about payers yet. They need to be educated too.
Yeah.
What are we doing for them?
Well, at Millennium, we do a lot of outreach to payers. Obviously, the biggest one who's hardest to reach is Medicare, because many of the patients are over 65. But in the private payer market, the insurance companies, we find a very receptive audience wanting to understand the data, wanting to understand what is the impact on patients, and people who are very driven about patient impact. So, for instance, with Velcade, we've had extremely positive coverage for patients because the data demonstrating a survival benefit over 5 years is so strong. So I've personally found that the payers are very much part of the constellation of people who are caring for patients, and that they're very receptive and thirsty to hear the data. They're also very critical thinkers about the data. So you can't pass by them something that's modest or not better than another thing and pretend it is, because they're extremely well educated.
What we have found is myeloma is not necessarily big on their radar right now because it's not one of the most expensive cancers that they're dealing with, but they are watching our model and what we're doing because they like the way that we educate our patients. So, for example, if a patient goes to our website and enrolls with the MMRF, then they immediately get a welcome, they get a PDF of information on the disease and then information on the treatments, and we're in touch with them all the way through their journey. And I think for a lot of the payer groups, they're looking at that and saying, that is a very economical and a great way to work with patients. We're seeing the same thing with a lot of the community oncologist networks who are saying, you already have CME materials, can we just co-market with you and provide those materials to all of our doctors? So, and that's a great idea, to be honest with you. As long as we're developing these materials, why not make sure the dissemination of the information is as broad as it possibly can be?
And why invest resources duplicating things when the resources are finite? So the more we can leverage what's already in place, the better it is.